Did you know that some of the medications you take to care for your heart might actually be hiding serious dangers? The trust you place in these drugs could be compromising your health in ways you might not even imagine. If you're concerned about your health or that of a loved one, this video is for you. Imagine discovering that a seemingly safe medication could be putting you at risk. The feeling of being vulnerable can be frightening, but the good news is that we're here to help. We'll reveal 10 common medications that can have dangerous effects on your heart and show you how you can protect yourself from these risks. Don't let a lack of information endanger your health. Watch this video until the end to understand how to avoid these risks and ensure that you're making safe decisions for your well-being. Your health is valuable, and we're here to support you. Minoxidil, originally used for hypertension, it can increase heart rate, cause fluid retention, and lead to other heart complications, even when used topically for hair growth. Imagine a guy named Lucas. He has always been very vain and liked to take care of his appearance. One day, Lucas started noticing that his hair was thinning and falling out. He became worried, as he loved his hair. A friend told him about a product called Minoxidil that promised to make his hair grow back. Without thinking much, Lucas rushed to buy the product. Let's tell the story of how Lucas began using Minoxidil every day, eagerly awaiting results. Over time, he did notice that his hair was fuller and more beautiful. But something strange started happening. Lucas, who had always had a lot of energy, began to feel tired more quickly. Climbing stairs became a challenge, and his heart raced faster, even when he was at rest. Lucas was intrigued but continued using Minoxidil until one day, while talking with his grandfather, he discovered something he didn't know. "You know, Lucas," said his grandfather, "Minoxidil was originally created to treat people with high blood pressure, not for hair. It can affect the heart, even if you just apply it to your head." Lucas was surprised. "What do you mean, Grandpa? I'm just using it to grow my hair." His grandfather explained, "Even so, Minoxidil can make your heart beat faster and cause swelling. If you have any heart issues, it can be dangerous." Lucas was worried. He had never thought that something he used for his hair could affect his heart. He decided to see a doctor, who confirmed what his grandfather had said. Minoxidil could indeed cause these effects, especially in people with existing heart problems. And so, Lucas learned that not everything that seems like the perfect solution is safe. He decided to stop using Minoxidil and look for other ways to care for his hair without risking his health. I see you haven't subscribed to the channel yet. Don't miss out on how to take care of your heart. Antifungal medications. Drugs like fluconazole and itraconazole can prolong the QT interval, increasing the risk of severe cardiac arrhythmias and worsening heart failure. Antifungal medications like fluconazole and itraconazole are used to treat infections caused by fungi, such as candidiasis or nail fungus. Although they are effective, they can have serious side effects on the heart. These medications can prolong the QT interval, which is a measure of the time it takes for the heart to recharge between beats. When this interval becomes longer than it should be, it increases the risk of cardiac arrhythmias, which are irregular heartbeats and can be dangerous. Additionally, if a person already has heart failure, these medications can worsen the condition, causing increased fatigue, shortness of breath, and swelling. It's important to use these medications carefully and always under medical supervision. Glaucoma eye drops. Beta blocker eye drops like timolol can reduce heart rate and blood pressure, leading to heart block and fainting, especially in people with pre-existing heart conditions. Imagine Mr. Joao, an elderly man who always cared about his eye health. He had glaucoma, a condition that increases pressure in the eyes and can lead to vision loss. To treat the problem, Mr. Joao started using eye drops called timolol, which are beta blockers and help control eye pressure. At first, everything seemed to be going well. But soon, Mr. Joao started feeling something strange. He noticed that he was getting more tired and, sometimes when he stood up quickly, he felt a tremor and almost fainted. His heart seemed to be beating slower, and he felt dizzy. Worried, Mr. Joao went to the doctor, who explained, "Mr. Joao, while timolol helps with glaucoma, it can also affect your heart. It decreases heart rate and blood pressure. For someone with existing heart problems, it can cause heart block and even fainting." Mr. Joao was surprised. "But I was only using it for my eyes." The doctor confirmed, "Yes, but the eye drops can have effects on the heart, especially if you already have a heart condition." Thus, Mr. Joao learned that even a seemingly simple medication can have unexpected effects. The doctor adjusted Mr. Joao's treatment, and he began to feel better, knowing that he was now taking better care of both his eyes and his heart. Before we continue, I noticed you haven't liked the video yet. Show us that you care about your health. Cold medications. Containing pseudoephedrine or phenylephrine, they can increase blood pressure and cause heart palpitations, especially in those with hypertension. Cold medications, such as those containing pseudoephedrine or phenylephrine, help to relieve nasal congestion but can cause heart issues. They can raise blood pressure and make the heart beat faster, which is particularly problematic for those with high blood pressure. Therefore, it's important to read labels and consult a doctor before using these medications if you have hypertension. Antidepressants. Some, such as amitriptyline and citalopram, can increase the risk of cardiac rhythm disturbances and elevate blood pressure, particularly in those with existing heart problems. Certain antidepressants, like amitriptyline and citalopram, can have significant effects on your heart. It's crucial to understand how these medications can impact cardiovascular health. Increased blood pressure. Besides arrhythmias, these antidepressants can also raise blood pressure. Elevated blood pressure can be a serious issue, as it forces the heart to work harder and can increase the risk of strokes and heart attacks. If you already have high blood pressure or an existing heart problem, this increase can worsen your condition and heighten the risk of complications. Importance of monitoring cardiac health. If you are taking antidepressants and have heart problems, it is crucial to monitor your health carefully. Discuss any symptoms you may be experiencing, such as chest pain, shortness of breath, or changes in heart rhythm, with your doctor. Your doctor can adjust the medication dosage, change the type of antidepressant, or add additional treatments to protect your heart health. Consult your doctor. Always inform your doctor about any existing heart conditions before starting treatment with antidepressants. With proper monitoring, it's possible to use these medications safely and effectively without compromising your heart health. Your doctor is there to help find the best balance between treating your depression and protecting your heart. If you have any doubts or concerns, don't hesitate to seek medical advice. It's essential to ensure that your treatment is safe and appropriate for your health condition. Let me know in the comments which medications you have at home and have used. Antibiotics. Macrolides, e.g., azithromycin, and fluoroquinolones, e.g., ciprofloxacin, can prolong the QT interval and exacerbate valve problems. Imagine Pedro, a young man who started experiencing a chest infection and went to the doctor to treat the issue. The doctor prescribed an antibiotic called azithromycin to help fight the infection. Pedro was relieved to start treatment, but after a few days, he began to notice that he felt more tired and that his heart was beating strangely. Worried, Pedro went back to the doctor and explained what he was feeling. The doctor then explained, "Pedro, the azithromycin you are taking is a type of antibiotic called a macrolide. It can prolong the QT interval, which is an important measure of the time it takes for the heart to recharge between beats. When this interval is longer, it can cause irregular heartbeats." Pedro also learned that another type of antibiotic, called a fluoroquinolone, such as ciprofloxacin, can have similar effects. Additionally, these antibiotics can worsen valve problems if you already have any. "So, my heart is being affected by the antibiotics?" Pedro asked. The doctor confirmed, "Yes, Pedro. It's important to be aware of these medications' effects on the heart and to always report any unusual symptoms. If you notice anything out of the ordinary, let us know immediately." With this explanation, Pedro understood the importance of monitoring his health while using the antibiotic and always discussing any issues with his doctor. Erectile dysfunction medications. Generally safe but can cause dangerous interactions with nitrates, potentially leading to fatal heart problems. Imagine Marcos, a man who was excited to try an erectile dysfunction medication. He knew that these medications, like Viagra and Cialis, are generally safe and help many people improve their sex lives. He was hoping it would bring new energy to his relationship. However, Marcos also had a health issue. He was taking nitrates to manage angina, which is chest pain caused by heart problems. These nitrates help relax blood vessels and relieve chest pain. Marcos was unaware that mixing erectile dysfunction medications with nitrates could be extremely dangerous. After taking the new medication, he began to feel chest pain, which soon turned into a very uncomfortable sensation. His blood pressure dropped rapidly, and he felt dizzy and disoriented. Concerned, Marcos sought medical help immediately. The doctor explained the situation. Erectile dysfunction medications are generally safe, but when combined with nitrates, they can cause a severe drop in blood pressure. This happens because both types of medications relax blood vessels, and the combination can lower blood pressure to dangerously low levels. This can lead to serious heart problems and even be fatal. Marcos was relieved to have sought help in time, but also learned an important lesson. He now knows the importance of informing his doctor about all the medications he is taking to avoid harmful combinations. ADHD medications. Stimulants like methylphenidate, Ritalin, can raise blood pressure and increase the risk of cardiovascular problems over time. ADHD medications, such as methylphenidate, Ritalin, are often prescribed to help improve attention and control impulsive behaviors. However, these medications are stimulants and can affect the cardiovascular system in several important ways. Here are the key points to consider. Increased blood pressure. Methylphenidate can raise blood pressure. If you already have issues with high blood pressure or other heart conditions, this can be a concern. It's important to regularly monitor your blood pressure while using these medications. Risk of heart problems. Prolonged use of stimulants can increase the risk of cardiovascular problems. This includes the possibility of heart diseases such as heart attacks and issues with blood vessels like atherosclerosis. Necessary monitoring. Regular follow-ups with your doctor are essential to assess how the medication is affecting your heart. If you experience symptoms like chest pain, shortness of breath, or increased blood pressure, inform your doctor immediately. Dosage adjustment. Your doctor may adjust the medication dosage or recommend changes in treatment to minimize risks. Never alter the dosage on your own without medical guidance. Health history. Inform your doctor about any history of heart problems or high blood pressure before starting treatment. This will help determine the safest approach for your case. It's crucial to be aware of these effects and work closely with your doctor to ensure that ADHD treatment is both effective and safe for your overall health. Diabetes medications. Thiazolidinediones can cause fluid retention, leading to worsening heart failure, although newer medications like Jardiance are considered safer. Imagine Anna, a woman who, after a routine checkup, was diagnosed with type 2 diabetes. Her doctor recommended a type of medication called thiazolidinediones to help control blood sugar levels. Anna was hopeful that this medication would solve her health issues. At first, Anna felt fine, but over time, she began to notice some strange changes in her body. Her feet and ankles started to swell, and she experienced increasing fatigue even after simple activities like climbing stairs. She also noticed that at night, her heart seemed to beat harder, and she felt short of breath. These symptoms were new and concerning for Anna. When Anna visited her doctor again, he explained that thiazolidinediones can cause fluid retention. This occurs when the body starts storing more water than it should. Imagine your body as a sponge filling up with water. Your heart has to work harder to push this extra volume of fluid. For those with pre-existing heart problems or heart failure, this can be very dangerous. The doctor described how fluid retention can overload the heart and lead to heart failure decompensation. It's like a car engine running beyond its capacity. Eventually, the engine might start to fail. In Anna's case, the fluid retention was making it difficult for her heart to pump blood properly, leading to symptoms such as swelling, shortness of breath, and extreme fatigue. Anna's doctor also explained that fortunately, it was not necessary to continue with that medication if it was causing problems. He mentioned new diabetes medications, like Jardiance, which are much safer for the heart. Jardiance helps control blood sugar levels but does not cause fluid retention. This means that Anna's heart would not be overloaded, and she would have a lower risk of heart failure-related issues. After switching to Jardiance, Anna began to feel much better. The swelling in her feet and ankles decreased, and she was able to resume her daily activities with more ease. She learned the importance of being attentive to the effects of medications and discussing any new symptoms with her doctor. Anti-inflammatories. Common anti-inflammatories can raise blood pressure, reduce the effectiveness of hypertension medications, and increase the risk of thrombosis, especially in those with heart disease. Common anti-inflammatories, like ibuprofen and diclofenac, are widely used to relieve pain, reduce fever, and treat inflammation. While they are effective for these purposes, it's important to be aware of the potential negative effects, especially for people with heart problems. Increased blood pressure. Anti-inflammatories can cause an increase in blood pressure. This can be particularly concerning for those who already have hypertension, as it may worsen the condition and increase the risk of cardiovascular complications. If you are already taking medication to control blood pressure, using anti-inflammatories may make these medications less effective, complicating blood pressure management. Reduced effectiveness of hypertension medications. The use of anti-inflammatory drugs, such as ibuprofen and diclofenac, can diminish the effectiveness of the medications prescribed to control high blood pressure. This reduction in efficacy occurs because anti-inflammatories can alter how your body processes and responds to blood pressure medications. Here's a more detailed look at how this happens. Vascular effects. Anti-inflammatories can affect the dilation and constriction of blood vessels. These medications may promote blood vessel constriction, which increases vascular resistance and can elevate blood pressure. If your anti-hypertensive medication works by relaxing blood vessels, the counteracting effect of anti-inflammatories can lead to less effective blood pressure control. Medication interactions. Anti-inflammatories can interact with other medications you are taking, leading to complex effects on your blood pressure. For example, some anti-hypertensives work by inhibiting certain enzymes or pathways that anti-inflammatories might also influence. This interaction can lead to unpredictable changes in blood pressure control. To mitigate these risks, it is essential to consult your doctor. Always consult your healthcare provider before starting any anti-inflammatory medication. Your doctor can advise whether it is safe to use these drugs in conjunction with your current blood pressure medication and suggest alternative pain relief options if necessary. Monitor your blood pressure. Regularly check your blood pressure to detect any changes that may result from using anti-inflammatories. If you notice any significant fluctuations, inform your doctor promptly. Understanding these interactions is crucial for managing your cardiovascular health effectively. If you found this video helpful, please subscribe to the channel and like the video to stay updated on more health tips and information. See you in the next video.